This video is one of a series that Contact's producing on different aspects of completing the DLA form. And in this video, we'll specifically look at the questions in the form about your child's mobility needs. Now, questions 43 to 53 of the form look at how your child manages in getting around outdoors. And your answers to these questions will determine whether your child gets the mobility component of DLA and whether this is paid at the higher rate or at the lower rate. Now, your child must be at least 3 years old to be considered for the higher rate mobility component, or at least 5 years old to get the lower rate mobility. Now remember, it's possible to get the mobility component for children who are able to walk but who have learning difficulties or challenging behaviours or other conditions that mean they need more help outside than other children. It's not simply limited to those children who have physical problems with walking. So for example, the lower rate mobility is awarded where a child needs more guidance or supervision out of doors than other children of the same age. It's often claimed for children who have visual or hearing impairments or learning disabilities, but others can qualify too, such as children at risk of seizures outdoors or children who are at risk of falling regularly when outside. Now, there are a number of different ways in which a child might qualify for the higher rate of the mobility component. Some groups of children will actually qualify automatically on the basis of their condition. So for instance, if a child is both deaf and blind, or if they have a severe visual impairment, they should qualify automatically. Some children with serious heart or lung conditions might qualify for the higher rate on the basis that the exertion of walking causes a serious deterioration in their health. But to qualify in these grounds, the recovery would need to take a significant period of time, and by that I mean many months, or it would need to require some form of medical intervention. So unfortunately, a child who needs a few days or weeks rest to recover won't be likely to meet this test. Now, one of the most common ways that a child will qualify for the higher rate mobility component is where their ability to walk is so limited that they're treated as virtually unable to walk. The law says that in looking at this, the DLA unit needs to take into account the speed, length of time and manner of walking, as well as the distance your child can cover before they start to experience severe discomfort, such as breathlessness or pain. Now, although the law says that the DLA unit are meant to take all of these factors into account, in practice, they will often prioritise distance over everything else, and they are usually reluctant to accept that a child's virtually unable to walk if they can walk more than 50 metres without severe discomfort. Now, this may be open to challenge where a child can walk more than 50 metres, but it takes them a very long time to cover the distance, either because they walk so slowly or because they stop so frequently. However, it's probably safe to say that the longer the distance your child can walk beyond 50 metres without experiencing severe discomfort, the harder it's going to be to convince the DLA unit to award higher rate mobility on the basis of being virtually unable to walk. Question 45 on the form asks you how far your child can walk. Please remember that you're being asked how far they can walk before they start to experience severe discomfort, not the total distance that they can walk. So if your child can walk 70 metres in total but starts to experience pain or severe breathlessness after only 40 metres, you should make clear that they cannot walk more than 40 metres without severe discomfort. Now, the test is how your child walks outdoors on relatively level ground rather than how they would cope on steep hills. Having said that, if they have difficulties in coping with normal things like uneven pavements or curbstones, you should say so in the form. And similarly, you should also make clear if your child's condition is affected by things like wind or rain or other common factors outdoors. Question 47 asks you to tick boxes to indicate what sort of problems they have in walking, but we would recommend that you also provide more detailed information about these difficulties, either in the box on page 53 or by adding extra sheets of paper if necessary. For example, Does your child walk with a limp, with a shuffle, or do they drag their feet? Perhaps they have balance problems that mean they can stumble and fall outdoors. Describe how walking impacts on their condition. Perhaps they experience dizziness or fatigue, get breathless, or even feel nauseous. Other children may start to feel agitated, upset, or panicky when outdoors. And if your child has a visual impairment, they may need extra help in following directions or avoiding obstacles, while a child with hearing loss may need someone to alert them to any dangers that's outside their field of vision. Now, one of the questions you're asked is if your child has episodes where they're unable to walk or whether they refuse to walk. Now, if refusals is an issue for your child, make sure you put information about this on page 53. While it's true that an award on the basis of being virtually unable to walk must be based on your child's physical condition, it doesn't mean it's restricted to only physical problems. Behaviour problems like refusal episodes can also count, so long as they're linked to a condition that has a physical cause, such as autism or a genetic or chromosome disorder such as Down syndrome. You'll need to describe not only how frequently behaviours like refusals happen, but also any particular difficulties you have in overcoming these episodes and getting your child to start walking again. It's not uncommon for the DWP to argue that a child who has refusal episodes is choosing not to walk rather than being unable to walk. So you're going to have to give information setting out the difficulties you have in trying to overcome these sort of episodes. For example, if your child can't be persuaded to start walking again by pleading with them or by promising a reward of some sort, that might suggest that it's not really in their control. If you know why your child has these refusal episodes, it can also be really useful to explain this. For instance, they might stop walking due to sensory distress, balance problems, lack of coordination, anxiety, or even a combination of these and other symptoms. If you can persuade the DLA unit to accept that any refusal episodes are not really in your child's control and that these behaviours are linked to a condition with a physical cause such as autism or a genetic disorder, then it's possible for them to qualify for the higher rate mobility on the basis that these behaviours mean that they are virtually unable to walk. Pages 48 to 50 look at whether your child needs more guidance or supervision outdoors than other children. Now, the information that you put in these sections will be used to decide whether your child qualifies for the lower rate mobility component, which can be paid from the age of 5. Now, your child should get at least the lower rate mobility component if they need more guidance or supervision outdoors on unfamiliar journeys than other children of the same age who aren't disabled. Now, guidance can mean either physically leading a child or giving them verbal instructions, or cajoling or encouraging a child if they become perhaps confused or upset. It might also involve helping them to avoid obstacles or things that would upset them. Supervision means watching over your child to make sure they're safe and monitoring their physical, mental, and emotional state. Now, the fact that all young children require some guidance or supervision outdoors is not the point here. Most children do not go out on their own. However, most young children do not go out on their own. However, a child with a sensory impairment or learning disability might require much closer supervision than non-disabled children of the same age. It's about looking at whether your child needs a different type of supervision than other children. For example, a child with learning disabilities may need an adult to hold their hand, to guide or watch over them much more closely in situations outside where most children of that age maybe only require someone to be with them. When thinking about this, it might make it easier if you make comparisons with your child's brothers or sisters or with their classmates. Now, do bear in mind that the test is the help your child needs on unfamiliar routes rather than on journeys they know well. So for example, if you have a teenager who's able to independently get around the streets immediately surrounding your home, they might still qualify for low rate mobility if they cannot go further afield, for instance, to the local town or other amenities without someone accompanying them. Now, the questions in this section about why your child needs someone with them outdoors may also be used to partly decide whether your child qualifies for the higher rate mobility on what is known as the test of severe mental impairment. Now, these rules are very complex and are covered in a separate webinar video recording that you can also access from our website on the pages about completing the DLA form.